Okay, hi everyone. So our research project is entitled Usability of an App Designed to Enhance Communication and Engagement. We're from Queen's University in Kingston, Ontario, and the University of Ottawa in Ottawa, Ontario. We would like to thank the Canadian Occupational Therapy Foundation for their funding support for this project. So our presentation today will start with a literature review, and then we will be giving you an introduction to the novel MyOTStride application. We'll then be going into our study methods, our preliminary findings from trialing the app, and our discussion and next steps. So the use of technology in healthcare is becoming increasingly prominent, especially considering the significant advances in communication technologies over the years. Occupational therapy, or OT, practitioners have been exploring the use of various forms of technology, such as communication technologies, including telehealth and telerehabilitation, which involves the provision of healthcare services from a distance with the use of technology, as well as the use of mobile applications or apps in consultation, assessment, education, and intervention. Given the accessible and cost-effective nature of telehealth or telerehabilitation in comparison to face-to-face therapy for certain clients, for example, those living in rural and remote areas, the use of technology in OT services can be a very reasonable and attractive option. While many therapists have reservations regarding the effectiveness and accuracy of assessments and interventions conducted via technology, some research has shown that the use of communication technologies is a viable option and produces results that are similar to what would be found in traditional in-person therapy. The effective use of technology can help to support successful therapy at various steps in the practice process and across many practice settings. And this is particularly relevant in today's context, given the situation that we're currently in with the COVID-19 pandemic. So apps that are currently used in OT services. So various apps exist that have been used in the provision of OT services, but were not necessarily developed for OT specifically. So some of these apps are aimed at helping clients with skill development and enabling participation in activities of daily living, or ADLs. Some examples of these include the magnifier feature that's built into iPhones and iPads, which can be helpful for those with low vision, for example. Voice-to-text features that allow the user to speak into the microphone to produce written text. So this can be helpful for individuals who might have difficulty typing. And there are also apps that are aimed at improving fine motor skills or handwriting. And other apps have also been created to allow assessments to be administered on a mobile device that are traditionally done on paper. So in terms of apps that were specifically developed for OT, we found a few in the literature. So the first one is PT and OT Helper. So this contains a bank of exercises to help with the treatment of medial epicondylitis, or golfer's elbow. It uses video tutorials for the exercises, and each exercise program is individualized for each client. Another app is called Aid for Decision Making and Occupation Choice. So the main goals of this app are to facilitate collaborative goal setting and promote decision-making between the client and the clinician. It contains 94 illustrations that depict daily activities that the client can choose from to assist with goal setting. So this app helps to identify meaningful activities, which in turn helps to guide the intervention plan. And the last one is called FACE. So this stands for face-to-face assessment, collaboration, and evaluation. This includes goal setting, problem-solving strategies, daily reminders, and self-rated performance. The aim of this app is to increase functioning and participation in daily occupations. So there are numerous benefits for using apps in OT. So one of them is that it saves travel time and money for OT and the client. So it can help prevent OTs or clients from having to drive to and from appointments, which in turn can save money from transportation costs. They can also increase a client's sense of control and independence. So especially for apps that are aimed at self-management, they can really help to increase a client's sense of autonomy. Apps can also provide opportunity for meaningful communication and engagement. And lastly, they can allow OTs to take on a larger caseload and have more time for other tasks due to the time that might be saved from using apps as opposed to engaging in in-person sessions when possible and appropriate. There are also some considerations when using apps or technology in OT. So first and foremost, the client's confidentiality and security should be maintained, and this should always be a priority. Also, the OT using the technology should have a thorough understanding of the application or system or whatever is being used to ensure that they can assist the client with any issues or know who to contact to inquire about any issues that may need troubleshooting. And we should also ensure the protection of the actual device the actual device that the app is being used on. So an example of this would be password protecting the phone or tablet that is being used.
So our app, MyOTStride, is a user-friendly application and web-based platform that is currently under development. MyOTStride connects clients to their occupational therapists outside of the clinic. The therapist and the client collaboratively identify goals, activities, and strategies, and the therapist inputs them onto the website, which the clients can then view through the app. Clients have the ability to provide comments and feedback to their OT regarding their progress, satisfaction, and confidence towards completing their goals. So there are two versions of MyOTStride. There's the client version and there's the therapist version. We're now going to take you through the features of the preliminary app and website. So we are currently looking at the client version of the app. The client version can be downloaded from the App Store for free. It's compatible with both iPhone and Android software. If you take a look at the slide, the image on the left is the login page, and the image on the right is the home screen of the app, where you can access all of the different features of the app, including feedback, goals, strategies, activities, settings, and connect. So once the client has downloaded the app and created an account, it will take them to the home page where they will hit connect, which we can see in the bottom left-hand corner. So once you've selected connect from the home screen, it will prompt you to insert your therapist's email. To connect with your OT, all you have to do is type in the email they use to create their account and click connect. Once the therapist has accepted you, their name will be listed under current therapist. So the therapist version is a website that can be found at myotstride.com. Once the therapist has created an account and logged in, they're able to view all current and pending clients on the home page, which can be seen on the slide. The current clients are listed at the top and the pending clients at the bottom. When a client is pending, a prompt will come up for the therapist to either accept or decline. And once the therapist has accepted the client will immediately be connected with their OT. So this is the goal page for the therapist. The client and the therapist will collaboratively set goals for the client. The therapist can then enter the goals by clicking on the blue circle in the bottom right-hand corner. The goals consist of a title, a description of the goal, and an end date. This is the goal page for the client. Once the therapist has inputted the client's goals on the website, they will appear in chronological order on the client's app. The client is unable to enter goals from the app, as this must be done by the therapist on their website. In the image on the slide, you can see some examples of goals, including baking a cake and taking the bus. This is the activities page for the therapist. So the therapist is able to input sub-goals or homework activities that will help the client reach the overarching goals. This can be done by clicking the blue button in the bottom right-hand corner. The therapist can input the activity, a description of the activity, and the dates they want the client to complete the activity. If a client needs an adjustment made to their activity plan or schedule, the therapist can easily make any necessary adjustments or changes. The therapist can then click on the View Feedback button to see how the client is progressing and if they have any comments or concerns. When the therapist clicks on the View Feedback button, they will be able to view how the client rated their satisfaction, progress, and confidence in completing each activity, as well as any comments the client has inputted. So this is pictured on the left-hand side of the slide. The therapist can then click the View Graph button, where the arrow is pointed, to see the client's satisfaction, progress, and confidence over time in a graph format, which is pictured on the right-hand side of the slide. This is the activity page for the client. Once the therapist has inputted the client's activities on the web version, it will appear on the client's app. The app will indicate whether or not the client has any activities scheduled for the day. If there's a day with no activities, it will say you do not have any activities scheduled for this day. But if there is an activity scheduled for the day, there will be a description of the task under the scheduled date. Similar to the goal section, the activities cannot be inputted by the client on the app. They must be entered on the therapist site by the therapist. This is the client's feedback page. So the client has the ability to provide feedback on the activities they are given. By sliding the white circles, they are able to rank their satisfaction, progress toward their goal, and confidence on a scale of 1 to 10. This is what you saw earlier projected on the therapist's graph. The client also has the option to leave more comprehensive comments about any specific concerns, questions, or achievements with each activity. So this is the therapist strategies page. The therapist can input strategies by clicking on the blue button in the bottom right-hand corner. The strategies serve as tools and reminders designed to support clients and help them achieve their goals. This is the strategies page for the client. Unlike the goal and activity features, the client does have the ability to enter any strategies they may think of or things they have tried and found successful. Similar to the therapist version, the client can add strategies using the circle in the bottom right-hand corner. So lastly, we have the settings on the client's app. And under the settings, the client has the ability to log out, delete their account, or change the theme, which alters the background colors of the app. So you can have it in bright colors or in black and white.
So now moving on to the study. This is a pilot study that in order to facilitate client-centered care and self-management, the MyOTStride app will allow for individualized goal setting, identification of strategies to achieve these goals, and the tracking of goal progress. For our recruitment, we looked for occupational therapists who work in the community and their clients who have diverse ages, backgrounds, and experience a variety of health conditions. This will allow us to get broad feedback and start to determine whom this app may be most useful for. Occupational therapists will be eligible to participate if they work in private practice or primary care settings in the Ottawa or Kingston area, provide therapy that extends for at least 6 visits, and use a cell phone regularly as part of their work. Each therapist will be asked to purposefully identify a client who may be willing and able to take part in the study. As of right now, we have tested the MyOTStride app on 6 participants. So we have 4 therapists, 3 females and 1 male that work in private practice, and 2 clients, 1 male and all females with mood disorders. the data collection, it will occur at 2 time points. The first is a structured interview that will be conducted with the therapist and their client together. The interview will consist of A, a demonstration of the app features, B, a guided trial and discussion of the usability of each feature, and C, a rating of the app using the consumer product questionnaire, and D, identification of missing or unnecessary features. The consumer product questionnaire was designed to measure user satisfaction with a variety of electronic products. It consists of 4 sections, including appearance, efficiency, fullness, and transparency. And under each section, there are statements that are rated using a 5-point Likert scale. The questions from the guided interview were on the 3 major parts of the app, so the goals, the activities, and the strategies, and what they liked, what they didn't like, and what would make it better. The interviews were also audio and video recorded to ensure the accuracy of the app features being discussed or referred to during analysis. After 4 weeks of trialing the app, the therapists and clients will be asked to individually answer follow-up questions, complete the consumer product questionnaire, and provide any feedback. This session will be administered online or over the phone. The content from the guided interviews will be analyzed by identifying themes and patterns. Then this data will be compared, contrasted, and integrated with the data from the qualitative data from the consumer product questionnaires to further inform the development of the MyOTStride app to ensure usability. So here we have put together the pre-feedback responses from the 4 therapists. Some of the things they liked about the goals, which are in the black outline, was that they were simple and easy to use. They also liked that the clients cannot add or edit the goals on their own. This means that they have to come up with the goals collaboratively during their face-to-face interactions. One therapist mentioned that there was nowhere to differentiate between long and short-term goals, and that this would be a helpful addition. Another therapist mentioned that the instructions when inputting the goals were not clear. Under activities, which is the middle column, the therapist liked that you could narrow in and be more specific to help break down goals. They also liked that there's a specific date associated with the activities. One of the therapists said that the activities felt like they were short-term goals. Another therapist said that it would be helpful for clients to be able to see their progress on the feedback graphs. Right now, only the therapist can see them. The 2 other common suggestions were somehow connecting the activities to the specific goals and to have a place for therapists to view the statistics for all clients simultaneously. For strategies, which is in the green box, the therapists like the clients can edit and add their own strategies. They help break things down further and make goals less long-term. The therapist said that it would be helpful to link the strategies to specific goals and activities, and that it would be helpful to have a drop-down list of the most common strategies to choose from. The therapist would also like to receive notifications when their clients make any changes. When asked if they had any additional feedback and how they would use this app in practice, these were some of the responses. One therapist said that the app would be very useful with return to work clients and that it is more of a behavioral approach. Many of the therapists said that it is a great way to add accountability, track progress, and be able to connect more frequently with their clients. They also mentioned that it is very helpful for clients to get organized, and overall, the app was easy to access and use. They also mentioned that the app might not work for all clients and that it would be very important to select the appropriate clients when using the app. So here we have some of the pre-feedback from the clients. In the goals, which is on your left side, the clients liked how simple it was to access and see their goals. They also liked having a set end date for the goal. They would also like to edit the goals, see their progress towards the goal, and have more of a contrast between each goal, such as having each goal appear in a different color, for example. For activities, which is the middle column, they like that you could get more specific and that you could schedule activities in advance. They also like the rating system when giving feedback after completion of an activity. One downside to the rating system is the words that are used, so satisfaction, progress, and confidence. One of the clients was confused around the meaning and the difference between these words. Some suggestions for improvement were being able to check off an activity when completed, having more of a calendar type look for the activities, and changing or further explaining the meaning of the words for the feedback scales. For strategies, which is on your right in green, the clients liked that they were easy to refer to, having input from the therapist, and that they provide more detail on how to accomplish the activities and goals. The edit button is something the clients like and would like for each of the sections. Here are some of the findings from the consumer product questionnaire. Again, the 5-point Likert scale goes from 1, which is strongly disagree, to 5, which is strongly agree. Below are some of the statements from the questionnaire and their agreement ratings. Under appearance, the statement, "I like the look of this product," received 2 agrees and 1 strongly agree. "The size of this product is just right," received 1 neither agree nor disagree and 2 strongly agrees. Under efficiency, both statements received 3 strongly agrees. Under helpfulness, "this product features are clearly explained," received 2 agrees and 1 strongly agree. And "this product helps me fix the problems if it goes wrong," received mixed scores of 1 disagree, 1 neither agree nor disagree, and 1 strongly agree. Under transparency, "I understand what all the selections do," received 1 agree and 2 strongly agrees. While "I sometimes don't know what will happen when I choose a particular selection," received 1 strongly disagree, 1 disagree, and 1 neither agree nor disagree.
Okay, so as previously mentioned, the current study is being conducted with occupational therapists in private practice settings who are working in the community. Initial findings suggest that their goals and progress suggests that MyOTStride app helps connect the therapist and client, enabling them to track their goals and progress throughout therapy. This helps them promote self-management and client-centered enablement, which, as mentioned earlier, are as the goals of the app in the current study. Based on initial feedback, the app appears to be relevant, accessible, and useful. Suggestions for improvement include using more common language, such as in the feedback section with the satisfaction, confidence, and progress towards goals. It was mentioned that this can be confusing to differentiate between what each of these ratings mean. Allowing the client to be able to edit more within the app was also a common feedback received. However, there was differing viewpoints from the therapist and client, especially in regards to the goal section. The therapist believed that the client should not be able to edit the goal section as they would like to complete the goal section together in person, whereas the client believed that they should be able to edit all sections, including the activity and strategy sections as well. The therapist had no problem with the clients editing the activity and strategies. There also should have more visuals in the client part of the app, such as with the feedback and being able to view a graph. MyOTStride app can have the potential to promote engagement outside of the client sessions, as it can be used for providing homework and keeping track of progress throughout therapy, allowing for more interaction, engagement, and involvement from both the client and the therapist. As this current study is still in progress, we have identified the following steps to take. We plan to conduct further recruitment of therapists and clients who are in private practice or in primary care in the community to participate in this study. We will be completing ongoing data collection by obtaining feedback after the app demonstration, as well as after the trial period. We will compile the data and post the findings. We plan to use feedback received from the study to continue to develop the app, making it more efficient and user-friendly. This will be done by providing the feedback received from the study to the app developers. Future research can consist of pilot testing the revised MyOTStride app once the changes have been made from the current study. Research can conduct with the app using different practice settings, as well as using more participants. This will help increase the generalizability of the research. Further research can examine the outcomes and changes of outcomes when using the app. This would be beneficial to note the differences the app use will provide when using it during therapy. We are currently still working at developing and bettering MyOTStride, and ideally with further research and revisions of the app could have the potential to become commonly used as part of occupational therapy intervention. Thank you for listening, and please email Dr. Dorothy Kessler for more information or if you have any questions.